Hello everyone, welcome back to my YouTube channel Dr.Barki's Ophthalmology Tutorials. Today we will discuss about ciliary ganglion. So it's a peripheral parasympathetic ganglion, as you all know. And where exactly it lies? So if you take the cut section of the orbit like this, means this is the bony orbit and we have the eyeball situated here, and our ciliary ganglion is exactly between the lateral rectus muscle and the optic nerve. Okay, somewhere here. So this is the lateral rectus muscle and this is the medial rectus muscle, and here the ciliary body is located almost 5 millimeters posterior to the globe, and this is a superior orbital fissure and it lies approximately 1 centimeter in front of the medial end of the superior orbital fissure. So it lies between the lateral rectus muscle and the optic nerve in the posterior part of the orbit. So what is the size of this ciliary ganglion? If you consider anterior-posteriorly, it is almost 2 to 3 millimeters, and horizontally it is almost 1 millimeter in diameter. The shape of the ciliary ganglion is polygonal. So this is mainly concerned with the intraocular muscles, that is nothing but the sphincter pupillae muscle, dilator pupillae muscle, as well as the ciliaris muscle, okay, which is there in the ciliary body. So it receives 3 roots, okay, which are entering into the ciliary body. So these 3 roots are motor root, sensory root and the sympathetic root. And from the ciliary ganglion there exits the nerves called as short ciliary nerves, which are almost 6 to 10 in number. And one more important thing here is the motor root. Actually this motor root, which carries the parasympathetic fibers, is only functionally connected in the ciliary ganglion. Means it relays in the ciliary ganglion and then the postganglionic fibers will come from the ciliary ganglion. Whereas the sensory root and the sympathetic root, they are just topographically connected, means they will just pass through the ciliary ganglion and there is no relay in the ciliary ganglion. So coming to the first root, that is the motor root, which will carry the parasympathetic fibers. Okay, as you all know, the origin of the oculomotor nerve from the midbrain at the level of the superior colliculus, so which is shown in the red, that is the oculomotor nerve. Okay, here comes actually your cavernous sinus, so it will pass through your cavernous sinus and then it will divide into the superior and the inferior branch in the half of the cavernous sinus or in the superior oblique fissure, and one of the inferior branches will go and supply the inferior oblique muscle. So these fibers, which are shown in the light green color, these are nothing but the parasympathetic fibers which are arising from the Edinger-Westphal nucleus, and then it will travel along the course of the oculomotor nerve, and few fibers which are going along the branch to the inferior oblique muscle will deviate here and then enter the ciliary ganglion and synapse here. And from here the postganglionic fibers will arise and which will exit the ciliary body in the form of short ciliary nerve. Okay, so there are around 6 to 10 short ciliary nerves which will be coming out from the ciliary ganglion, and through this short ciliary nerve it will pierce the sclera and enter into the perichoroidal space. Okay, so then they will travel along the perichoroidal space and supply the ciliaris muscle as well as the sphincter pupillae muscle. Okay, so the parasympathetic fibers will supply the ciliaris muscle as well as the sphincter pupillae muscle. So what will happen if these parasympathetic fibers are stimulated? It will lead to constriction of the pupil and there is accommodation. Means how the accommodation will happen here? Because there is stimulation of this ciliaris muscle, there is constriction of the ciliaris muscle leading to relaxation of the zonules, which will lead to the anterior bowing of the lens, which will lead to accommodation. Okay, so this is the parasympathetic fibers are the motor root of the ciliary ganglion. Now coming to the sensory root for the ciliary ganglion. So this is just topographically connected, as I told. So we have what is known as the trigeminal ganglion here. So this has 3 branches. One is the ophthalmic branch, and then the maxillary branch, and then the mandibular branch. From the ophthalmic branch again we have 3 branches: the frontal nerve, the nasociliary nerve and lacrimal nerve. So this nasociliary nerve is what we are concerned with now. So this nasociliary nerve will run forward and then gives various branches like posterior ethmoidal nerve, anterior ethmoidal nerve, and finally it will end as infraorbital nerve. Okay, so what we are concerned with is, so this will give a branch to the ciliary ganglion. So this nerve will pass through the ciliary ganglion and then enter the short ciliary nerves and then again pierces the sclera and runs in the perichoroidal space. That is one thing, and it will also give the branches known as the long ciliary nerve, which will again pierce the sclera and run in the same space, and it runs forward and then supplies the cornea, ciliary body and the iris. So these nerves will in turn carry the sensation from the cornea, iris and the ciliary body. So this is about the sensory root of the ciliary ganglion. Now moving on to third root of the ciliary ganglion, that is from the sympathetic root. So the sympathetic fibers which enter the ciliary ganglion, they are already post-ganglionic fibers, means so from the ciliospinal region of CA to T1, we have the preganglionic sympathetic fibers which will relay in superocerebral ganglia. Okay, from there the postsynaptic sympathetic fibers will arise and then they will form a plexus around the internal carotid artery and then it will enter the ciliary ganglion. Okay, so it will just pass through the ciliary ganglion again and then enters the short ciliary nerves, which will again run in the same suprachoroidal space and then run anteriorly to supply the dilator pupillae muscle. And it can also accompany the long ciliary nerve sometime and then enter the suprachoroidal space to do the same function of supplying the dilator pupillae muscle. So what is the function of this sympathetic fibers in the ciliary ganglion? So the stimulation of this sympathetic nerve will lead to dilatation of the pupil and then leads to accommodation for the distance and then reduces the blood supply. So these are the three roots of the ciliary ganglion, that is sympathetic root, parasympathetic root and the sensory root. And these short ciliary nerves which I was telling, which are 6 to 10 in number, they will form two bundles actually, superior bundle and the inferior bundle, and then pierce the sclera around the optic nerve and take a course in the perichoroidal space. So hope this short video on the ciliary ganglion is helpful to all of you. If you like my videos, please do subscribe to my channel, press the bell icon for further notification. Please do like and share my videos and leave your valuable comments. Thank you so much.